Typhoidland is really a whole series of research projects that we started in 2018. And the goal was very much to see how typhoid control has evolved over the past 200 years. And at the same time, using the past to re-engage audiences around the world about the need to tackle typhoid collectively, because it's become very much a neglected disease on the global health agenda. And again, because we conceived of this project both as a research project and an engagement project, this feeds into exhibitions that have attracted tens of thousands of visitors across 3 continents now. So the research was carried out in multiple locations across the world by multiple teams, primarily really involved going back to the archives. And we really found that places like Oxford, but also other major cities like London, were successful in creating clean water infrastructure, not in a kind of one-off intervention, but that actually their success was based on their ability to make mistakes and the ability to mobilize resources at the municipal level to kind of build and gradually optimize an infrastructure, but also maintain that infrastructure. Another kind of big research focus that we had was then also looking at how the kind of ideals that we have don't necessarily translate very well into other non-European environments. In the case of Dublin, we find that adopting a London-style sewage system, which depends on kind of flushing all of the dirty water out of the city, ended up contaminating the shellfish banks. And so what we find is a pronounced increase of typhoid, ironically, by adopting this model of the hygienic city. We also then look at how typhoid is currently re-emerging as an increasingly multi-drug resistant threat. And this was very much rooted in popular and political perceptions of typhoid as a disease that had been defeated. But this notion of defeat was based on the fact that the defeat had only ever happened in rich countries around the world. And so this is not just important in terms of regalvanizing global action, saying it never was defeated, it never became a disease of the past, it just became a disease of poorer countries. All of these examples really showcase the need for kind of broad, long-term analyses of how humans, sewers, water, and the broader environment all come together. In terms of policy, the work has been presented at WHO level, and it has had an impact both in terms of how we structure public engagement and in terms of quite well-received academic publications.